one of the things that I wanted to talk about today is because I've had some incidents in the office with some individuals who have kids that have had chronic ear infections. They've done the tubes. They're gone through the traditional process that's still going on, even though it's been shown pretty significantly and to be ineffective and unnecessary. And I just wanted to go into a little bit of discussion on that because otitis media, or ear infection, is a very common condition with children. 88% of the time, right now, we see resolution to that problem without any intervention. And I just have repetitively, I keep talking to people who are still doing the old going down the road of antibiotics and then tubes and all that. And I just wanted to read a couple of things that came out of research that I was looking at. There's a couple of studies here that I thought were pretty significant. One, 650 children revealed significant reduction in ear infections and fevers and improvement in immune function and general health after adjustment. 95% of them, after the first adjustment, the red and bulging and tympanic membrane returned to normal in 95% of the cases. Another study, 332 children ages 27 days to 5 years old suffering from recurrent bouts of otitis media who had been on repeated doses of antibiotics and were given chiropractic care. The children healed quickly without antibiotics and experienced few repeat infections. Another study, 211 infants examined 5 days after birth who suffered from vomiting, hyperactivity, sleeplessness. Chiropractic care frequently resulted in immediate cessation of crying, muscular relaxation, and sleepiness. The authors, who were medical doctors, wrote that an unhealthy spine causes many clinical features from central motor impairment to lower resistance to infections, especially ear, nose, and throat infections. They assert that all newborns should have their spines checked by chiropractors, as the success of adjustment overshadows every other type of care. There's a doctor at the University of Pittsburgh. He's the head of ornolaryngology, which is basically ear, nose, throat. According to E.J. Kantikin, professor of otolaryngology, University of Pittsburgh School of Medicine, there is no evidence that antibiotics are effective in treating acute otitis media or a chronic otitis media with diffusion, fluid in the ear. And there is clear evidence that antibiotics are harmful. So why are we still doing it? And
this is out of
the University of Pittsburgh's medical school. You know, the guy is E.J. Kantakin is a professor down there who teaches ear, nose, and throat. So this is what he's teaching. Yet we're still doing some things that aren't necessary and probably are doing harm. The issue is that the medical approach is antibiotics, drugs, and surgery. And the most common medical treatments for ear infections are antibiotics, oral decongestants, and surgery. Tubes in the ears. None of these treatments is safe or effective. That's the problem. I mean, there's an alternative treatment that's available that is much more effective, that's been shown to be more effective, and these kids are not being directed in the right way. They're continuing to do what they do, even though they know it's not the right thing to do, instead of saying, hey, why don't you try a chiropractor? These kids need to be adjusted. They should be adjusted right at birth, let alone once they already are sick. And so it's not, again, I have to point out that most of the research is not chiropractors doing research. This is medical research that's coming to those conclusions, even though they don't want that to be the conclusion, by the way, in a lot of these cases. They're hoping to prove that what they're doing is working. But in the study, it comes out to show, probably not. So, in a double-blind study, children with otitis media were divided into 4 groups: surgery, antibiotics, surgery and antibiotics, and no treatment. So some had surgery, some had antibiotics, some had the surgery and the antibiotics, and the other ones had no treatment. Recovery time was about the same for all 4 groups. No difference. Another study showed that 88% of the patients with acute otitis media never needed antibiotics, and that antibiotics led to a more likelihood of a repeat infection, which is what we know. So here we are. I just had a kid in the office the other day whose mom didn't know that it was even a problem, wanted to know, well, what do you do then? And was being directed down that road, has already had tubes in the ears to help the fluid drain, but still having repeated infections, and has used many rounds of antibiotics. I'm just wondering, when is the insanity going to end? When are we going to start to be honest? When are we going to start to, look outside of the box that we're living in and start to see a world of children who were injuring greatly? The idea of what we know about the gut, and we talk about all the time in here, about the immune system connection between the microflora of the gut and the nervous system and immune system connection that we're learning more and more about every day, and the genetic expression of that immune system function that's so intimately entwined in that healthy bacterial flora being in good balance. We don't really digest our food even. We farm that out to that bacterial flora. So it's extremely important in our digestion. It's extremely important in absorption of our nutrients. And so essentially giving somebody an antibiotic as an infant is leading toward a malnutrition state because they're not able to absorb the nutrients that they need, which is also another secondary hit to the immune system, aside from the primary hit to the immune system, which is 2/3 of your immune system is that bacterial flora that you live in symbiosis with, that you live in cooperation with. So here we are treating our infants in an extremely sterile environment to begin with, so they're not really getting a good, healthy mouthful of bacteria in the first place when they first come out of the womb. So everything's sterile. We're fighting to keep infections out. But the reality is that the more we sterilize that environment and the more we sterilize those individuals, the more likely we are to get infection from that. And we're causing infections due to our misunderstanding of the environment and our misunderstanding of the expression of that environment within our own bodies. We need to live in cooperation with that. The idea that germs are our enemy, most germs are good. There are some bad guys out there, and usually even the bad guys are just overgrowth of what's normal due to imbalance in the system being harmed by either some chemical poison, an antibiotic, or some health issue like malnutrition that has created an extreme imbalance. So although there are some other cases out there, they're extremely rare. What we're talking about is the average and the norm. And so, but the average treatment and the norm treatment is not congruent with the knowledge that we have of the day.
So the kid that comes in with the tubes in the ear, are you still able to help?
Oh, absolutely. Yeah, certainly. Most of the time, as soon as you get them adjusted, man, that's a problem's history. We don't see them having repetitive ear infections anymore. I've seen so many kids that this story is been told again and again. The reality of it is, even after multiple ear infections and years of punishing treatment and surgeries and all the issues that are going on, that generally within a couple of adjustments, these kids resolve. I'm just amazed, actually, after all that just to start getting them adjusted, and it straightens things out. You know, I don't know why there's such a misunderstanding or misconception about it. It's very safe. It's about the safest treatment that is known on the planet as far as a health care system goes. You know, it's much safer than an antibiotic to adjust that cervical spine of a child. They're so easy to adjust, and they resolve and respond so well to it. So all I'm really trying to plead with some parents that give it a try. Don't keep punishing your kids with outdated, antiquated, and unproven and obviously harmful treatments that are continuing to be done because they don't really understand what the whole condition is all about and what the alternatives are.
Do you think some of that has to do with chiropractic in general, where people think, oh, it's just back pain? If you have back pain, you just
absolutely. I think that's the biggest misconception. You know, that although chiropractic adjustments do a very good job at removing subluxations that cause back pain in some people, the reality of it is that's just small potatoes. And if the reality of that too is back pain is not that easily resolved even with chiropractic. I mean, there's a lot of multidisciplinary approach that goes into treating somebody with a serious back problem. People, physical therapy and chiropractic and medicine, surgeries. I mean, these things are all commonly have to be incorporated to individuals with back problems. So certainly, I don't think that anyone should claim that they're, going to fix everybody's back problem, because it doesn't happen that way. As a matter of fact, I tell people all the time in my office that their back problem is something that has developed to this point, and prevention is the cure, because there is no cure. And no matter whether surgery a lot of times can be very beneficial, it can help, it can remove some of the material that's there that's affecting those nerves. Getting adjusted, we can adjust vertebrae and remove them from the pressure on the nerves that's causing a lot of the pain. Therapy can get some modality work in there and do lots of really good things to help with muscles and ligaments and really help with the health of that joint. Just general knowledge. I mean, they used to give a book away, I think they still do, in a lot of medical offices, which was the McKinsey low back exercises out of Australia. McKinsey had a series of stretches and exercises that help people who are in bad way with back problems. But what I mentioned to most patients when they come in with those especially severe problems where their pain is going all the way down their leg and they have a low back problem, is that all I can do is remove the subluxation and give your body a chance to heal itself. If we can maintain that subluxation in a good position long enough for their body to heal up, then it's going to be stronger. But throw the kitchen sink at this problem. Don't just commit that I'm going to do this or I'm going to do that or I'm going to do this. Anybody who has something that they can offer you that is helping, absolutely you should be doing. There shouldn't be well, I want to see if this works or I want to see if that works. Well, let me tell you something. These low back issues that a lot of people are suffering with are extremely serious and crippling. And the ego of any individual who would say, well, I don't want you to do that or that, I just want you to do what I do, is really harming and injuring a lot of people, because the more multidisciplinary approach that you throw at it, the better chance of a good outcome. Mm-hmm. And I think that with that being said, that is a extremely common problem. It's a very popular problem. A lot of people are dealing with that problem in my office, but it's small potatoes compared to what the potential is by removing subluxation from the nervous system and seeing the effect of what that has on the body, and the removal of interference to the nervous system, allowing and restoring normal balance to that body and giving it a chance to start taking care of itself the way it's meant to be. You are a self-healing, self-regulating organism. If the spine's in line, that system is working better. I think, as I said, when we look at what E.J. Kentanken, professor of otolaryngology at the University of Pittsburgh School of Medicine, there's no evidence that antibiotics are effective in treating acute otitis media or chronic otitis media with effusion, fluid in the ear. No evidence. That's the truth. There isn't any evidence in that. We're still doing it. You know, the idea that the things that we do in healthcare are actually backed by research is ridiculous. Show me a double-blind study on open heart surgery. They don't do it. There is no such thing. There's no double-blind study on whether or not open heart surgery is good or bad. They just do it. And I'm not saying it's bad. I'm not saying you have to have double-blind study to do that. But what I'm telling you is that it's not the gold standard of science, which is the double-blind study, is not being performed on every. As a matter of fact, most aren't. It's 80-some%. There's clear evidence that antibiotics are harmful, no doubt. So here we have a very profound statement from the otolaryngology School of Medicine in Pittsburgh. The professor is saying this. He's saying this to us, he's saying it to the world, he's saying it to his students, and he's absolutely right about it. Antibiotics don't work for ear infections. They don't work for acute ear infections. They don't work for chronic ear infections. There's absolutely no scientific evidence that says that it does. There's no clinical evidence and no scientific evidence. On the other hand, there's very good evidence, clear evidence, that antibiotics are harmful to children who were treated with otitis media. So make decisions based on the truth, not what's going on out there in the public. You know, a lot of things that we do don't necessarily match up with what we know. And my suggestion of any parent who's dealing with a kid who's had multiple ear infections, who's dealing with these kinds of things, they've off to the otolaryngology specialist for tubes and whatever else they decide to do. Bring the kid in for an adjustment. Get them checked. This is what the clinical evidence is telling us at this point. This is the truth, and in my office I see it on a regular basis, and it's amazing. It's amazing to see. I love to hear from parents. I actually love to hear them say, why didn't I know this? Well, I don't really love to hear that, because they should have known. We should all have known. And the reason I love to hear it, though, is because it means that kid turned around like that, and they were like, oh, so simple. How could I have not known this? And so I hear it all the time. I hear it all the time. How did I not know that this was what I should have done? I'm so glad I'm here. I hear it all the time, every day. And it's about the kids. It's not about me. It's not about the parents. It's not about any other doctor's ego. It's about these kids and our health of these kids as they grow up. It's a really important thing, and I think we all need to start investigating. You know, I suggest study it. You know, go out and start researching it yourself. Find out the truth.
Well, speaking of studying, here's a story this morning. Joanna Stepka is the soda industry's new nightmare. The 33-year-old Rhode Island resident began drinking Diet Coke in kindergarten, graduating to 3 cans a day by adulthood. She quit in August after her gym trainer told her artificial sweeteners are unhealthy and make people fat even if they don't have calories. And the whole article goes on to explain the money and the marketing behind that.
Yeah.
And that now the soda companies are
fighting back.
Well, they're starting to scramble because more and more people are speaking up, and sales of the diet products are shrinking.
Well, good. Aspartame's a terrible thing, and it's in all of it. NutraSweet is aspartame. You remember when it was called NutraSweet, we all found out it was bad for us and stopped eating it, so they changed the name to aspartame, and now we're doing it again. And there's a couple other names of that out there too. But there was a good study a couple years ago. It was like 3,000 New Yorkers they followed around, and the ones who drank regular pop versus diet pop, and the people who drank the diet pop gained a significant percentage of greater weight over the period of time of the study. It's the biggest study that's ever been done on it, but it was a significant p-value that showed that people who drink diet pop actually gain more weight if all other conditions are equal. So it's not like they're eating more calories or they're drinking more of it or whatever. They're basically all other conditions were equal. If you're drinking diet pop versus regular pop, you will gain weight from drinking the diet pop. So I think that's what we're seeing, and the future on that is hopeful that they will scramble and change it.
Well, and that being said, the same article says here in the survey, 46% agreed artificially sweetened soda is unhealthy, including more than 50% of the consumers younger than 35. Mm-hmm. So those younger people are...
Well, the interesting thing about that, though, is often I talk, and we're all in this boat, as we're sitting there drinking a diet pop saying, this isn't good for me. Yeah. Right. So we
and you hear that with smokers, they'll...
Everything, right.
Yeah.
So we're sort of in a paradox there, in that as consumers, we have to start making wiser choices. It sounds like there people are doing that. They're stopping the craziness of drinking the diet pop. No pop is good for you. That should be the theme song of this, is that it doesn't matter whether it has aspartame in it or sugar. It's still going to be bad for you. It's all the chemicals and the bad stuff in there. Fine for a snack once in a while, once in a great while, but definitely should not be thrown in our kids' lunch pails every day. Diet soda is in the lunch pail. That's just a scary, ridiculous idea. The person who goes to work in the morning, by 9 o'clock he's already drank a Diet Pepsi, and he's drank 6 before the end of the day. I mean, these are bad ideas. Now, is it any better if they change over and start drinking Coke? No. You know how much sugar's in that? I mean, sugar is bad for you. Sugar substitutes, even worse.
Let me ask you real quick, and then we have to wrap things up. Where do you see this conversation 5-10 years from now?
Well, on the diet soda.
No,
or on
healthy eating, and even the chiropractic side. You know, when you're hearing stories like the doctors saying, you know, this is bad. Or,
well, the vision is there of a world of wellness style of healthcare system versus sick care, and it needs to be led by, I think, the chiropractic profession, because we're the only ones out there who are actually trained well enough to even understand what it really all entails. But on the other side of that too, we all have to start living that lifestyle-based system that we need to see. So consumer-driven America is, we will see on the shelves what we are choosing to buy. If you are choosing the garbage because it's cheaper or whatever, then it's going to stay cheaper and it's going to stay on the shelf. But if you start to make that shift and shift over to the better product, the more by the way, there's just such an overabundance of information out there that it's confusing and it's very difficult. But it needs to start with the basics, Our fruits and veggies need to be grown with better care so that we are not taking the nutrition out of them or changing the nutrition in them so that they're becoming bad for us. We need to look at purchasing those things that we know have not been modified too much so that we can trust it. We need to understand that there needs to be a system in place where that's better than the one we have, that protects us as consumers from these big corporations who can do really whatever they want with food additives and things like that. Now there's no law really. You can put a carcinogen in your food if you want. It's okay. Proven carcinogens can be in our as a food additive without any question. We talked about the Delaney hearings and them taking this out of law, that you were no longer it was no longer a law that you had to protect people, and it's up to the companies on their own to produce safe products. Well, where does that end up? So there are many different aspects of this that are going to have to come into play if we're going to see much change. And the first and only thing that we have control over is our own consuming. If we choose to consume Diet Pepsi, Diet Coke, whatever it is,
then that's continue to be there.
Right. If we choose not to, then that's going to fall away, or they're going to change it. They're going to make it better, But as long as we continue to buy it the way it is, why change it?
Dr. Adam Middleton, thank you so much for your time. And again, if folks are listening and they say, my kid is experiencing this, contact the office, set up an appointment.
Yep.
All right. Thanks, Doc. Have a great day. Have a great week.
Yep. Thank you.
All righty. See you tomorrow, 7 a.m. for the morning drill.
Netcasts originating from the birthplace of the oil industry. We are The Stream. Streaming